don't have access to fresh fruits and vegetables. So I think we got to figure that out as well.
That would be a point I would make also about food deserts in many communities out there. When people don't have the option of buying
Right,
fresh fruit,
right,
vegetable, then they turn to, as we know, the corner store. And that's
right,
where many people make their groceries or see my Louisianian and make the groceries.
right.
Go buy their groceries. But Eric, let's hear from you on this.
Well, I think the numbers are staggering. You have about 40% of our population that's obese, with about 10% that's severely obese, and it's projected to be by 2020 about 50%. So we got to do whatever we can to prevent obesity. Disallowing junk food with SNAP benefits is perfectly logical. I don't think it hurts anybody. If anything, it kind of helps reduce the obesity, helps reduce costs for healthcare, because all this is kind of tied together. And I think the stats show about 25 to 40% is increased in our medical system just based on obesity alone. If we can lower that amount, it'll stop kind of the problem. It'll hurt less with the problems we have in the medical system and also our society. So I think anything we can do to prevent obesity is a good thing.
All right, Ron, let's hear from you. Your thoughts
Isaiah,
about Senate Bill 379.
I find it very interesting that these Republicans are so concerned about obesity and healthcare when Texas leads the nation with the highest number of uninsured. We don't have Medicaid expansion in Texas, and many families could be literally living if they had access to healthcare. I think that this bill is an overreach. I think that these families should be able to have the freedom to decide what is best for their families. I don't see any problem with it. I think they should encourage fresh foods. But as was pointed out by Representative Jones, there are so many food deserts. There's so much and especially inner cities and underserved communities, they lack grocery stores with fresh food. So many of these convenience stores are the only option that some of these families have. And until we change that, I don't think that we should take this option away from those families.
And welcome back to The Factor Uncensored. Lawmakers have passed a bill, but that bill still has one more step before becoming law. Now, if it eventually becomes law, it would prevent people from using SNAP benefits on junk food like the cookies, the cakes, sodas. Now, the bill's author argues it's meant to get back to the intent of SNAP program and focus on nutrition. Critics say people using SNAP should be able to have choices when it comes to their family's food. Our next guests continued their discussion saying, look, you could even use delivery services to get those fresh foods to their neighborhoods. But some say some of those delivery services will not come to certain urban communities. Let's pick it back up.
And what do you tell someone, Angela, if they're struggling to find fresh foods because they don't have a car or transportation in their neighborhood, but they have those SNAP benefits, and it's difficult for them to find those fresh fruits and vegetables that you're referring to that will get them healthy?
You know, it's the kind of thing where Donald Trump is working with HUD, like he did in his first term, to create opportunity zones in underserved communities. I mean, I have no problem with federal money coming in and trying to build up those areas, because I agree with Jolanda. You know, it's healthy minds, healthy bodies, and better citizens. When you are healthy, happy, and free, you're going to be far less likely to commit crimes or to even be on government assistance, because you're going to be able to work. And people need to have the opportunity to get those fresh fruits and vegetables. And, you know, coming from, I can't say that I have that experience, but, you know, hearing Ron talk about it and Isaiah talk about it, you know, buying groceries from the convenience store, you know, that hit me a little bit, because, again, it's not an experience that I have. But I think that we can definitely work on getting grocery stores to open up their doors in those communities. But it also has to be a situation where people have to respect those stores and not loot them or rob them or things that stores aren't building in those communities for those reasons. So it's a holistic kind of thing that needs to happen.
I would also.
I tell you what, if they are robbing those stores, they ain't robbing them of fresh fruits and vegetables. And very rarely, I'm going to slightly modify my position. I actually agree with Representative Reynolds, because again, some places, the only thing you can buy is processed foods. And so in this bill, there needs to be some some ability to be able to use the SNAP benefits wherever you can buy food if there's not a grocery store that you have access to that sells fresh fruits and vegetables. So I would actually add an amendment to the bill or try to add an amendment to the bill to do that. But I think that in my community, especially in the African-American community, there's so many people with high blood pressure, they're on dialysis. I mean, they literally, are dropping dead because of the way that they eat. And sometimes they just don't know better. I mean, my grandmother, I love the way she cooked, but it was not healthy. And she died younger than she should as a result. And so I think that maybe we phase this in, or maybe we make an ability, if you don't have access to fresh fruits and vegetables, that you can buy at the convenience stores. But I think eventually we need to move towards having grocery stores in all neighborhoods so that we all have healthy options.
All
But
right.
I'd also note, I just want to say one thing, and this might help y'all. There's something called Instacart. And on Instacart, you are allowed to use SNAP, EBT SNAP benefits. I'm looking on their website right now. So, and even if the grocery store isn't near you, you can log on to that app's Instacart and you can have the fresh groceries delivered right to you. And there you go.
Eric, I would be curious if they had, if those delivery services were available everywhere. I would think that there would be limitations if they provided all zip codes. I mean, we don't know. So that's why I agree with Representative Jones. This would need to be vetted. So there are some exceptions because there are people, I know Angela says she hasn't had this experience, but I know people that live in food deserts. They live in communities where there's no grocery stores. The only thing that they have is the convenience store. So I don't want to leave those people out. Those people, I want children and families to be healthy. But if we really truly cared about all families, then we would have more access to healthcare and medical services. We wouldn't be trying to take away these things from families. Black women lead the nation in Texas with maternal deaths. There are so many issues that need to be addressed. I don't think that this bill is a great priority that we should be focused on.
And I'd also wonder if you're paying a premium for Instacart. I don't know if that's true or not. And also, what about the digital divide? There are whole neighborhoods, just like they don't have grocery stores, they don't have access to the internet. Those people would not be able to use Instacart. So again, there needs to be vetting. I understand the intention of the bill, and I think eventually we can get there, but there are other things that we need to fix first.
All right. Well, we'll have to see what happens with Senate Bill 379. And we want to thank you guys for joining us here on The Factor Uncensored tonight. And Angela, once again, congratulations on your wedding.
Thank you.
What's your last
It's been
name?
forever.